Health Care Hospital. I'd like to share with you the HIFU treatment of huge placenta accreta. So my contents include the basic information of the case, diagnosis and treatment, and experience summary. Patient, 34 years old, married. Admission date, August 26, 2019. Main complaints, induced labor over 11 days after 21 weeks. A history of present conditions, give birth to a dead baby and the placenta is not delivered. Postpartum provides contraction. The 400 milliliters of the blood bleeding. Obstetrics include the full-term natural labor, abortion twice. And the ultrasound shows a stronger echo of about 11.4 plus 9.5 plus 5.6 centimeters. And the uterus is large and the cervical smooth, hypertrophy. There is no abnormalities. This is ultrasound. The cervix in all sides of the uterus, and the blood flow is rich. The acoustic pathway is clear. MRI scan is consistent with ultrasound. So the placenta accreta is diagnosed. We have provided a HIFU treatment, similar to the case of Dr. Ying. The placenta accreta is huge and the follow-up is complete, is longer. So the total operation time is 145 minutes and the total sonication time is 2,850 seconds. And the intensity is very strong. And we have added up the treatment to 2,850 seconds. This is fleshy tissues from the vagina was discharged, indicating the residual placenta tissue by pathological examination. And the B ultrasound indicated 4 centimeter space in the uterine cavity. The patient requires to be discharged for follow-up. The 2-month follow-up. From the ultrasound, we can see that the decreasing of the volume of the uterus from 11 to 4. Half a month later, the residue in the cavity is less than 3 centimeters. Half a month later, the volume continued to decrease to less than 2 centimeters. You can see that the blood flow was rich before the surgery, and after the surgery, the blood flow is not that rich, showing the decreasing of the residues. September 2019 to March this year, indicating that there may be some residues in the uterus. Hysteroscopic surgery is conducted. After HIFU treatment, the duration time is long and the power is strong. We are suspicious of the adhesion, but we found that the uterine cavity is very good. There is a small plates on the left corner of the uterus, and the patient was conceived naturally after 22 months, and a healthy full-term baby was delivered without placental residue implantation and no postpartum hemorrhage. So with the follow-up and the 2 months after surgery, menstruation continues. So as for summary, In the